Baptist South, go ahead.
This is Rescue 91. We got a 21-year-old male in an NBC.
I want to confirm the fact the patient's ejected, the patient has a GCS of 3 and pressure of 80, is that correct?
Yes, sir.
Go ahead and call a 911 trauma alert.
911 trauma, 5 minutes down to 4A, 911 trauma. We tried intubating him in field rounds, but unsuccessful.
Patient does not respond to pain or verbal commands.
Get ready for the back. Yep. Got him. Doping just fine.
With distal pulses.
What's his respiratory rate? I got 126 on the heart rate. Got 89 on the SAT. Temperature. We need to get him up to 100. 97.2.
Let's get ready for intubation. Here we go an X-ray CAT scan and avert the trauma surgeon, please.
Bilateral breath sound.
Still a flow chest sick. Dr. Gerberson?
Yes, sir.
The ultrasound shows that the abdomen is full of blood. You want to just go ahead and take the patient to the OR directly?
Sounds good. Let's do it.
All right.
Fortunately, this is not a real patient. This is a simulation for training purposes only.
What you saw was not a real emergency. All of the medical procedures were being performed on SimMan.
SimMan is about the size of an average-sized man. He has arms, legs, mouth. He talks. He breathes. He's pretty amazing.
We can make his blood pressure change, his heart rate change. We can, right now I'm going to make him talk.
I can't breathe and my chest hurts. Hell.
Got real pulses. You can feel things, hear things with a stethoscope. You can hear actual heart rhythms with a stethoscope. I mean, this is all real, real things.
There's a lot of different things that you can practice on the mannequins. Inserting chest tubes, starting IVs, a lot of skills that it's just like working on a human.
Computerized, they can put various programs in based on what scenario you want, for what specialty that you're wanting.
I think the intubation exercise is very real and very effective. I like the central line pouch. It feels just like the skin, so I think it will give the residents and the training students a good chance to kind of perfect their skills before approaching a real patient.
There are several areas on SimMan's chest where you can attach leads and actually perform an EKG.
The simulation is very real. I mean, you can actually hear breath sounds. You get a good sense of the tube when you put it in. The rhythms are real. To be able to feel the pulse, not feel the pulse is very helpful when you're doing these simulations. You do a real IV stick, which is great.
His tongue is very realistic, has a very real look and feel. It can actually simulate swelling and make it more difficult for SimMan to be intubated.
As close to real life as you can get without using a real person.
I think the medical management team training and the simulator will take Baptist Health to an exceptional, optimal level of patient care for the simple fact of the training that it will give us.
I was very surprised by how realistic some of the scenarios were and could be reproduced by using the SimMan that you would see in actual clinical practice.
Everybody all sort of rushed in, and then on the next day of training we kind of learned this is what we did wrong, this is what we need to do to improve. And everybody just sort of had a role, and you kind of knew what those roles were.
We were actually the first participants, and we were not prepped with what was going on. And we thought disorganization was normal, and we found out that you can have organized chaos.
I think we're evolving from organized chaos to really a more functioning type of team that is delivering the best patient care as a result of this.
From a physician and training standpoint, the majority of our training comes with real life situations, and therefore all mistakes you make are real, everything you do is real, and from there on out is real. But this just gives you the opportunity to step back, reassess the situation without actually harming an individual.
It gives feedback that I never got. The feedback and the educational learning that they get from each episode is so imperative to making process improvement in the quality of care that we deliver.
When you do it in the hospital in a live, real setting on a real patient, you kind of miss that part of fine-tuning the communication. So I think this is the ultimate of what this simulator is going to do.
There's nothing that we can do that's more important than improving communication for patient care. Communication between caregivers and between the patient themselves is critical.
We had
an intubation, an unexpected intubation in the recovery room that went very smoothly because I was real keen to the fact that I need to step back rather than get in, and I learned that directly from SimMan.
It helps to fine-tune the teamwork.
Yeah, just like with anything.
It's a good team as it is, but the simulations just bring it all together that much faster.
Every nurse that I know personally that walked out of that scenario said it was the best thing they'd ever been to.
I think instead of shooting for 98 or 99% safety, we should shoot for 100% safety.
We don't want to leave one person out when it comes to this kind of training.
It just makes you so much more comfortable when you get in an actual code that you know what to do and you do the right thing for the patient.